So one of the most common questions that we get often about cervical cancer screening and pap smears is how often we do them, because a lot of that information has changed over the years. So in this episode, we're going to go over when you start getting your pap smears and also how often you get them then and thereafter. I realized over editing the last couple videos is I rambled a little too much. And so what I want to do for these next episodes is really give you that information right at the forefront, so you don't have to listen to me ramble all the time. Also post call twice this week, so we're gonna get through this. Welcome to the New School OBGYN. My name is Eric Schmidt. I'm a board certified OBGYN, and it matters where you get your information. So as with everyone and even myself, double check your information to make sure you're getting what is correct and up to date. A very quick recap of the previous episode is that cervical cancer and the body's ability to prevent it and get rid of it depends a lot on a couple things. One is HPV and the exposure to HPV, and the other is really around a healthy immune system. So let's keep that in mind when we're talking about how often and why we do pap smears at these different intervals. So we start cervical cancer screening, or the pap smear, when someone reaches 21 years of age. And so why don't we do it sooner than that, you might ask? Because it's definitely possible to be exposed to HPV before that. But again, keep in mind that someone younger has a pretty healthy immune system. And so what they found is that doing pap smears in this younger population, younger than 21 years old, was just a little too much intervention for the relative risk of cervical cancer or pre-cancers of the cervix being almost non-existent in this population, and much less than 1% of all cervical cancers, actually 0.1% of all cervical cancers are found in this age group. And so while people are definitely exposed to HPV in this age group, they found that also they fight it off the quickest and resolve any potential early changes of the cervix to a normal cervix a lot quicker than some of the other age groups that we'll talk about here in a little bit. For example, if somebody has low-grade changes in their pap smear, someone in this age group has about a 95% chance of resolving that low-grade change in the next 1 to 2 years without any interventions at all. Just a healthy immune system, getting rid of the HPV, and making the changes in the cell back to normal. However, there are some things that someone younger than 21 should be doing, because again, they are potentially being exposed to HPV if they're sexually active, and likely are. And so being proactive about that with the HPV vaccine, which we will talk more about in future episodes. I know vaccines are a topic of debate among some people, but really this is a way that we'll talk about how to prevent cervical cancer and the bad types of HPV. Also in this age group, someone should be considering things like STI screening, to hopefully looking out for themselves and protecting themselves, because a lot of the STIs, including HPV, are often asymptomatic, and so but may impact your long-term health. So someone's now reached 21 years of age, and now we're doing the pap smear. How often do we do it? Well, again, there's two components to a pap smear generally, or cervical cancer screening, I should say, is that there's the cytology or the pap smear, and then there's also the HPV screening. Now, for someone in the age group of 21 to 29 years old, we just do the pap smear or the cytology alone. We don't do the HPV testing usually, unless a certain scenario, we'll talk about it in a second. And so in this age group, we're doing the pap smear, if they're normal, every 3 years until they reach the age of 30. And so some people out there might be thinking, well, why every 3 years? Because they might be used to the saying of, well, you get your pap smear done every year. That's a couple decades ago now, because again, they realized that doing it every year wasn't giving the body enough time to really resolve a lot of these HPV infections and low-grade changes on its own. Again, 95% resolution rate for the low-grade changes. And so sometimes if we do the pap smears too often, we actually do too many interventions because we see these potential low-grade results persisting, when in reality, give it a year or two of time, it'll resolve itself. Now, that being said, we still follow closely if somebody has an abnormal, even if it is a slight abnormal. And again, we'll talk about abnormal results and how we follow them in a future episode. We're also potentially adding the HPV test if somebody has the result of ASCUS, or atypical squamous cells of undetermined significance. And so this is when you do the pap smear and they're looking under the cells in the microscope, and they're just really uncertain whether or not there's low-grade changes, or maybe it's just inflammatory changes. It's hard to tell. That's when that HPV test test, or reflex test we call it, comes in handy, is because if the HPV is there, we're like, okay, maybe this could potentially be a change caused by HPV. If the HPV is not there, sometimes we just assume that this is often just a reactive change, and we try to definitely not be too interventional in those situations. There are a number of academic groups which might give their own recommendations for getting pap smears done, whether it's the cytology, the HPV, and they might have separate recommendations. And so what I'm going to go through is generally the most accepted recommendations here in the United States at this time, because it will be changing, probably. Moving on to the next group, age 30 to 65. Now, this is a big age group. Again, we're doing the cytology at least every 3 years. And so the first option in this group is to just do the cytology or the pap smear every 3 years. Actually, the recommended way is now to add the HPV test, because again, we know that for pretty much all these cervical cancer changes that can happen, it needs HPV. So in this age group, we're adding the HPV test to the pap smear for everyone, and this is called co-testing. And if somebody has normal results, the new recommendation is that we might do this every 5 years. I have noticed in my own practice that it is hard for some people to make that jump to thinking they need the pap smear every year to now doing it every 5 years, and I can totally understand that. And so sometimes even with co-testing, we can even screen every 3 to 5 years. I think there's some potential flawed logic with these age group recommendations that we can, while these are recommendations, we can individualize it for each individual patient. And we'll go into some examples here in a second. But I do want to note that it is extremely safe to do it every 5 years for somebody with a negative cytology and negative HPV, especially if they're not being exposed to any new strains of HPV anymore, because the potential rate of developing a higher grade change or cervical cancer is like less than 1%. And for the age group over 65, for someone with normal results, especially in the last 20 years from then, we are often saying you don't need to do pap smear screening anymore, especially if someone isn't being exposed to any new strands of HPV. Now, there are situations which we can talk about here in a second. So if someone does have some abnormalities in those years preceding the age 65, we continue the screening until we get multiple normal results. And so we may still screen beyond the age of 65. And another scenario that we often run into is, well, what if I have a hysterectomy and my cervix is removed? If you don't have any abnormal paps preceding that, you don't need any more cervical cancer screening done. If someone does have hysterectomy and their cervix is kept, you stay in the normal guidelines. But if somebody did have abnormalities of their pap smears, especially the higher grade abnormalities is what I'm talking about, and they get a hysterectomy and cervix is removed, we know that HPV and the changes associated with that can affect the upper vagina as well. And so we do still want to screen these patients, even just swabbing the top of the upper vagina when the cervix is gone, again, to fully make sure that the changes of the now vagina don't turn into anything precancerous or cancerous. Once someone gets, again, normal results for multiple tests in a row, we are then usually discontinuing it altogether. There are actually some special situations. Well, you might be asking, Eric, well, I might have a compromised immune system because maybe someone has a history of HIV. Maybe somebody has a history of being on immunosuppressive drugs, whether that's because they've had an organ transplant or that's because they have a rheumatological disease or inflammatory disease where they're on immunosuppressive therapies. You might actually need your cervical cancer screening done at shorter intervals. And so talk to your doctor about your specific situation to see if you might need your cervical cancer screening done at closer intervals because of the given disease. I said for the most part that I agree with a lot of these screening recommendations, but there are a few situations, and you might have heard me kind of give my little flavor there on it, because some of these assumptions are made for HPV and when we do the screening, thinking that people and young people are exposed more in their early 20s to HPV, maybe having potentially more partners at that time, and then, classic American dream of settling down and potentially not having more partners in the 30 to 65 age group or 65 and beyond. And so that's why I say sometimes we can tailor the screening recommendation for the given patient if potentially they might still be having potential other partners partners are being exposed to new strains of HPV. And sometimes it may be worth not waiting potentially 5 years in those populations, or potentially discontinuing screening altogether for someone 65 or older, especially if there are new sexual partners. It's definitely warranted to continue the screening. I think it's important to recognize that these are all just generalized guidelines. It's like, you know, if you've seen Pirates of the Caribbean, it's like pirate code. You kind of follow it, but you don't have to go exactly based on what they're saying. All right, that basically wraps up how often we screen, or when we start screening and how often we screen. If you feel like there's something I could elaborate a little more on, please leave a comment down below. If there's any specific questions regarding this information, leave a comment down below. If you guys don't mind, hit like, subscribe. It helps us out, gives us motivation to keep making these videos, everyone. Okay, not too bad for being post-call and doing 2 calls this week. So all right, we'll hopefully see you guys soon, and we'll talk about abnormal results on a pap smear in one of these next upcoming videos. All right, guys, have a good day. Everyone's probably watching this video and they're like, oh, wow, he doesn't look great.